Now doctor, integrin connects the actin. Once more, if you go back to the high yield topics list I have given to you, 10th or 11th topic will be heart sounds, right? So that is the reason there are about 70 topics in high yield topic list in medicine. Heart sounds invariably is asked whenever you go to the exam. Murmurs and heart sounds is a topic in itself. So go back to the UMedico, go to the video library, UMedico app, video library, DNB, high yield topics, you have got the heart sounds topic, pick it up, listen the video, review, you will get a non-evaporable solid confidence. That is a point. Integrin connects to the actin through which macromolecule in the extracellular matrix is a very important question. It is the fibronectin. Typically, I have one illustration actually, somewhere it got missed. Actin, then this fibronectin, and you have the collagen that is there. So that is how integrin connects actin to through the fibronectin, ultimately to the collagen in the extracellular matrix. That is what you need to basically appreciate. Now, erythropoietin, where does it basically act? It acts on the colony forming units. So, erythropoietin is a glycoprotein produced by the peritubular cells in the kidney, all of you know. Then if you look at the erythropoiesis, you have a pluripotent stem cell, a blast forming unit, colony forming unit, then you have a pro-erythroblast, erythroblast, then a reticulocyte, and finally erythrocyte. Out of all these series, it is the colony forming unit that has the highest number of erythropoietin receptors is what you have to fundamentally remember, one of the favorite questions of the examiner. With regard to the T3 and T4, how do they act on the thyroid hormone receptor? Once more, secondary messengers, hormone receptors. Top high yielding topic in physiology. Out of the 30 topics in physiology that I have given you the list, today only you go and start playing quizzes until you get the confidence. It acts on the transcription factors. So typically inside the nucleus you have the DNA, DNA ke upar you have the intracellular DNA binding proteins, and the thyroxine acts on this hormone responsive transcription factors just like the steroids also. If you give steroid, immediately action doesn't begin because steroid cell membrane cross करके, cytoplasm cross करके, nucleus cross करके, DNA के पास जाके, फिर DNA responsive elements को stimulate करके, then the DNA से RNA आके, RNA से protein बन के, बाद में action दिखाएगा. इसलिए don't think you will put a prednisolone and it will do miracles. No, it won't do. It takes its own sweet time to show its effects is what you need to remember. What is the color of 16 frenchfoley catheter? AIIMS examiner ko, they want practical students who spent lot of night duties with the best nurses available in the hospital, so that कम से कम फोली लगाना आता या नहीं आता मालूम करने के लिए. How many of you house surgeons did not put the Foley catheter? I had once a HIV prick. 2 times I had. Once while putting a pigtail catheter for a cardiac tamponade patient who is a HIV. Second is there was a medical student whose father had HIV. The poor guy was crying almost. So I said, don't worry. I was putting the Foley catheter. By mistake, that needle, while we need to take out a syringe, and then push the fluid. That time the needle got pricked, and once more I felt I had all the secretions of the patient on the what you call the glove. 2 बार लिए थे. So lot of times we prepare so much for an entrance exam and practically we will be zero, but still no problem. After joining MD also you can learn if you want to learn. But only difference is house surgeon में एक बार भी अगर आप Foley catheter नहीं लगाए तो I still remember one of the topper. So Foley catheter time पे जरा betadine लगाना बोले तो like a Shivabhishekam, he was putting betadine until we were worried that there will be a chemotoxic injury to the genital organ of the patient. So like a Shivabhishekam, he is pouring betadine. So be very sure, right? What is the color of 16 French? It is orange. You have 16 orange, red is 18, yellow 20, purple 22, blue 24, black 26. You think all this you have to remember for going for MD entrance exam? No, not really. At least remember why 16 only was asked, you should know. Examiner wants you to be a very practical guy because practically in adults what do you use? 16 to 18 French. So that is the reason 16 ka orange, 18 ka red khali yaad rakho. Pediatrics mein you use between 5 to 12 Foley catheter. If the infant is younger than 6 months, then you will use a feeding tube which is 5 French with tape, and adult with gross hematuria you will be using the 24 French. 20 to 24 French. If there is a gross hematuria, that's what you need to remember, but this is the favorite area of the examiner. Something or other you should do, right? Most likely on Wednesday, the notes feature become appearing in the U-Medico to bookmark. Today only I reviewed with my technology team. It all has come up very good. And even you can record a voice file on a particular slide, and all your voice files will be available so that you can listen to your own voice files on those points that you felt that you will forget, and you can share it with others. You can listen others' voice files. Everything is a wonderful learning platform, right, doc? Now, patient had road traffic accident on mechanical ventilator, and he opens eyes on verbal command, moves all the 4 limbs spontaneously. What is his GCS score? Very good question by Danish. Sir, French अंदर का diameter या बाहर का diameter? Huh? So even that can be a very good MCQ, right? So what is the score? Very simple. As I told you before exam only, Glasgow coma scale भी अगर आप what is the Glasgow coma scale? Sir, it is 0 if you say no. That means you have never touched the topic. Minimum Glasgow coma scale is minimum 3, right? So it is E3 V1 M6 that equal to 10 in GCS. So how will you remember? ICE, you have a maximum 4 score. ICE, EYES only you can remember. ICE, E is eyes are shut. Y-shaped, sharp, pricking object respond to pain. A pricking response to pain. और pain को cause करने वाला चीज will be a prick will be Y-shaped. So you can remember Y. E, ear piercing noise. Ramaya, uto, uto, uto. You are shouting in the ear, right? So response to voice, अगर दिखाए तो eyes open करे तो बुलाए तो, that become 3. And spontaneous, opens eyes spontaneously is equal to 4. Some stupid way of remembering. Then for the verbal, you can use vowel. V is voiceless. Second, obscure, O. That is, if he is making incomprehensible sounds, बोल रहे patient. That is incomprehensible. Third, inappropriate words बोल रहे. पेन को पेंसिल बोल रहे, गीता को सीता बोल रहे, That is 3. 4th is erratic, disoriented, confused words. 5th is legit. That is normal oriented conversation. Oval is a way to remember. Then finally, old Ben is a very famous way to remember the motor response. Right? I leave the literature for you in the UMedico notes. So please download the app. All these slides will be available in the app in the notes accessible. Right? Now, in a road traffic accident, a young man is brought to the emergency. 2 units of packed RBCs and 4 platelets are obtained from the blood bank, but there is only 1 IV line which is accessible. So what will you do? You can always store the platelets at the room temperature. The most important priority here is the packed RBCs. Now the patient will go into congestive heart failure. So start PRBCs first and store the platelets in the room temperature is considered to be the answer. So platelets. Have you seen any platelet typical yellowish colored one? It is stored at room temperature. आजकल तो डेंगू फीवर आने के बाद सबको platelet transfusion देना समझ में आ गया. Platelets are constantly agitated and they last only for 5 days. And 1 dose of platelet should raise the platelet count by around 30,000. At least 10,000 rise हुए तो we are happy. And they are infused within 15 minutes is what you have to basically remember. Where do you do the sentinel lymph node biopsy is a very important question. Very good. Happy to see 248 online viewers across the country. Kush Hua Mogambo. Right? So please call all your other friends also from all the social forums, WhatsApp groups, so that my students are our ambassadors to make this a popular program. So doctor, carcinoma endometrium. What is the meaning of sentinel lymph node biopsy? Every organ, whenever it drains lymph, there will be one first node to receive, then second, third and fourth node. That first node को अगर आप टेस्ट करें, इसमें metastasis नहीं है. That rules out possibility of the remaining nodes getting the metastasis. So that is called sentinel lymph node biopsy. That sentinel lymph node is that watchman kind of a lymph node, and in fact, based upon the sentinel lymph node status, you can always be able to take a decision whether to radiate or whether to give chemotherapy or not. Such big decisions can be taken. I am seeing a lot of you saying vulva is the answer but not endometrium. No. Actually both of them. But traditionally it is the carcinoma endometrium where sentinel lymph node biopsy is the one which is most often practiced. But and it also made a lot of impact in the endometrial carcinoma. Just sentinel lymph node negative hone se you have left it and staged it with a good prognosis. Now nowadays, even for the vulval cancer also, the sentinel lymph node biopsy has become a standard operating procedure. So that's the reason both vulval cancer and endometrial are possible, but endometrial is one of the traditional practices of sentinel lymph node biopsy. Vulval recently they started, that's the point. Even breast also, absolutely right, as Manoj Kumar is saying. What is the cause of the thyroid storm? Typically, a poor preoperative preparation, radioiodine nahi diya. You have not cooled down the thyroid sufficiently and operated on the patient is the underlying cause. Second thing is a severe illness. A severe illness in a hyperthyroid patient also will lead to thyroid storm. If it is a surgery associated post-op complication, commonly it is the poor pre-op preparation is what you need to fundamentally remember. Now doctor, thyrotoxicosis has a lot of symptoms, but all symptoms do not appear if a thyroid storm occur on the operating table while you are operating on a poorly prepared case. Intraoperatively, how do you recognize? Any unexplained tachycardia, hyperthermia or arrhythmias, only these will be the presenting features of the thyroid storm. In fact, hyperthermia, cardiac arrhythmias are the only two things that you will see if there is any general anesthesia, is what you need to remember. So how do you manage thyroid storm? Intraoperatively, emergently you have to use beta blockers. Then you need to decrease the ambient room temperature of the OT. Only thing is, you should not be a surgeon who will suffer Raynaud's phenomena because of the coldness of the operation theatre. You have to infuse cold fluids, and draping in ice cold packs and administration of steroids are considered to be the ones which you will manage a intraoperative thyroid storm. Pyloneal sinus treatment के लिए, which is the flap based procedure you use. Once more, if you go to 65 topics I gave you in the surgery high yield topic list, this is not very high yield, but lastly, pyloneal sinus is one short case. So this is a little unexpected. I accept that 20% of questions are too much. Oh, MCH plastic surgery और MBBS को एक ही क्वेश्चन पेपर रहता क्वेश्चन बैंक से. On the other side, नर्सिंग MSc नर्सिंग का क्वेश्चन बैंक और MD एंट्रेंस का दोनों मिक्स हो जाता एम्स में. Like French catheter, what is the French color of the catheter and all that. It is a rhomboid flap. First of all, let us learn what is pyloneal sinus. Typically in the gluteal cleft, some people are very hirsute, they are all very hairy guys. So the hairy guys may, a pyloneal sinus is the pressure area, the coccyx is there, right? So a obese hirsute guy is sitting constantly, then between that bony coccyx and the underlying gluteal area, gluteal adipose tissue, there is a lot of pressure. Because of that, a small cleft is created in which the hair get incarcerated, that lead to pyloneal sinus, and that can even get super infected and lead to the formation of a pyloneal abscess, is what you have to basically remember. That's right, Nikki Arora says Jeep drivers. So this is a sinus tract, this is the hair incarcerated with the cyst and fluid into the adipose tissue underneath the skin of a hirsute male. So there are the midline holes, the hair follicles are enlarged, there is a pulling force between the sacrum and skin, and all that force is concentrated is in 1 millimeter square area. So that is the whole situation. And for this we use what is called a Limburg flap. And for putting that Limburg flap, we have to do a rhomboid shaped incision. So excision of the overlying skin. So flap is not rhomboid, it is Limburg flap, and excision is of the shape of the rhomboid, is what you need to remember. So this is a typical rhomboid incision, and once you have excised it, rhomboid excision, once you have done, this is the defect created, and you are making a Limburg flap which is being placed, and post-operatively how it basically looks like. So this is the story of, and post-operatively ask the patient to avoid prolonged sitting. So too much of NEET PG preparation के लिए reading room में बैठ गए तो क्या मिल सकता? NEET PG में rank बाद में सोचो, pyloneal sinus होने का chance तो compulsory it is there, and then you have to land up in a Limburg flap, right?